Hi, everyone. My name is Rana. I am the newsletter editor for San Jose State's ASIS chapter, and I'm also a first-year student in the informatics program. This is going to be, upcoming in spring. It's going to be my second semester, so I'm really excited for that, especially since I'll start off by taking some of the health career pathway courses. So I found this especially relevant in terms of being able to research this. I hope that this is informative for you guys as well. To preface this presentation, I wanted to add as well that we've been going over the various career pathways in MLIS. So last month we did the digital services career pathway, and we're going to continue on to do some of the other career pathways, not only for MLIS, but also for informatics and for MARA. So please look forward to when we do those. Alrighty, so health informatics as defined by HIMSS, which is the Healthcare Information and Management System Society, is the integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. Now, why is this important for our modern society today? Ultimately, health informatics means that there's an overall improved patient experience through the collection, management, and analysis of data when done right. Now, this means that, in short, improved patient outcomes, patient safety, and quality of care become a reality. I also wanted to highlight the current course offerings. So, as I mentioned before, there are a variety of courses that are being offered by the iSchool, and these are the most current ones that are being offered on a rotational basis. So when I say that, I mean it's best to be able to check on the informatics section of the iSchool website to see when these courses are being offered, because some may come and go. So just keep yourself abreast of what's happening with that. And so health informatics and epidemiological methods are being offered next spring. If you haven't signed up for them already or interested, definitely recommend those. Health data and analytics is offered in summer, and healthcare organization and policy for informatics professionals is going to be offered in fall. If you're an informatics student, then we're able to take a total of 9 elective course units, which means that you can either do a sole concentration of one of the career pathways of cybersecurity or health, or you can do a combination of the two so that you take the courses that you're interested in. So I wanted to also highlight some helpful skills to develop. Of course, medical terminology is a must if you're considering the field of health informatics. And so this could refer to, human anatomy and physiological terms, terms related to the body systems, pharmacological terms, so brand or trade names for medications, as well as terms related to diagnoses. Also, programming languages are, a highly sought after skill that candidates should be ready to have either Java, Python, SQL. Those are some of the more common programming languages for candidates in this field. And then another common technology that is used in the informatics field, specifically health, is the EHR. EHRs are electronic health records. So this is the digitized patient records most oftenly used in healthcare organizations, whether it be a hospital, clinic, or other healthcare organization. So I listed some of the more common EHR vendors that you'll probably see, which will be Epic, Cerner eTenant, and Meditech. And then as well as hard skills, some of the soft skills you come across that would be helpful to develop would be instructing others through learning new systems and processes. So this means, as an informaticist, oftentimes you'll need to lead someone through a training, and this could be one-on-one or conducted in a group setting. Also, communication skills. It's important to be able to verbally and through writing have an information exchange via your colleagues, upper management, and other members of the multidisciplinary healthcare team. And then last but not least, a lot of patients, and of course that applies whether you're a student or an early professional. This could be like dealing with large data sets. That could be a trying process. So yeah, patience is key in this field. I also wanted to highlight some of the more common careers that you'll see in the health informatics field, from entry level to more mid-level and senior level positions. We have the health clinical informatics specialist. They work with data and act as a liaison between clinicians and data. And the roles include modifying and designing systems to improve workflows and educating and training staff on correct procedures and new systems and updates. Now, the clinical data analyst, in their role, they develop and maintain databases for healthcare organizations and have oversight of externally and internally sourced data management. And for the nurse informaticist role, it's a very unique role in the sense that you not only have your nursing experience in a certain specialty or specialties, if you have more of a breadth of knowledge, you also combine that with technological expertise and your educational background in order to serve as a liaison between the members of the IT department, members of the informatics department, and other members of the multidisciplinary healthcare team. And then for the health informatics manager, they bridge the gap between IT department and other care team members and assist the IT department to better understand the needs of the end users. So some current job opportunities, I was able to find some on LinkedIn and Indeed. So we're just kind of gonna go over some of the basic requirements, some of the roles and responsibilities, just to kind of get a feel for what is being looked for in candidates for these positions. The first one is the Associate Analyst of Clinical Informatics for Level 1 Help Desk. And this is for Molina Healthcare, which I believe is based in Southern California. However, this position, what makes it a really attractive aspect of the role is that it is a remote position and it is entry level. So as you'll see, the role provides application, hardware, and software technical support for the care connections and clinical informatics teams. And for their required education, high school diploma or GED, they do prefer associate degree, and then someone with preferred clinical IT background, experience with EHR applications, as well as English, Spanish language background are also pluses. And then one of the highlights, that I noticed is that they're looking for someone who has empathy/passion for working with senior, disabled, or low-income populations, as well as someone who has excellent customer service, active listening, and verbal and written communication skills, and Microsoft Office proficiency as well. So the next position is the ICM Clinical Analytics Analyst 1, and this is for Sharp Healthcare based in San Diego, California. They are looking for someone who provides data analysis, systems analysis, programming, technical execution, reporting, and tool development for identified clinical analytics needs across their organization. And for the required qualifications, they're looking for someone with a bachelor's degree in an applicable field, such as computer science, business administration, nursing, or healthcare administration. Otherwise, relevant experience in excess of 3 years or appropriate certifications might be able to be substituted. And then someone with clinical analytics applications and reporting experience is also preferred for this role. They also highly suggest in the description that someone be proficient in required programming languages like SQL, VBA, CCL, as well as Merlin, Cognos, BI solutions, and MS Excel and Access. And then for the last position, which is also based in Southern California, this is a hybrid position. For those of you in the area, there's a healthcare data analyst 1 for quality systems. And so for this role, they are looking for someone responsible for providing technical, analytical, and reporting support for the health plan, clinical, and provider departments, programs, and quality activities. The person must be able to understand relational database concepts, table design and structure, joins, data normalization, and data types. So proficiency in Microsoft applications, including MS Access, SAS, SPSS, Crystal Reports, system-specific reporting tools, and other related reporting software is also important to this role. And for the experience qualifications, they are looking for someone who has at least 3 years of relevant experience, or in lieu of experience, a master's degree. And then, of course, experience in the healthcare field is preferred. And for educational requirements, a bachelor's degree. So that pretty much wraps up the presentation. I hope that you found some things that were informative and maybe some things that you didn't know about the health informatics field. I really appreciate you being able to join us. And if you have any questions, you could totally put that in the chat box. You're more than welcome to ask them after this. Otherwise, thank you so much, and I really appreciate you for being able to join us tonight.